Hello. It's good to see you again.
Hello, good evening. Thank you for inviting me.
Oh, I always love to have you on. Your YouTube channel is wonderful. And everybody, hi, it's Maryann Harman. And this is Dr. Sridhar Sundaram. And we have interviewed him before. He is a wealth of information. His YouTube channel is a fantastic source for people that work with children. And today, Dr. Sridhar is currently consultant neonatologist at Medicine Al Jawhara, Jahara Hospital, Aleen, in the United Arab Emirates. He trained in India at Stanley Medical College, Jipmer, Pondicherry, and PGIMER. I'm not sure what that means, but I'd love you to tell us. And he worked in the United Kingdom as a consultant for over 7 years. Currently, he's been working in the United Arab Emirates, leading the NICU in many prominent hospitals. And he has, as I mentioned, his YouTube channel and Facebook Telegram groups for neonatal education. So you are a busy man, and I do appreciate your taking the time to come on and talk with me.
It's my pleasure. Thank you, Maryann. And congratulations to you on Sophie's arrival. You're a grandmother. And all that you apply for other children are now applied at home. I don't know how much you did with your daughter when she was young, but...
I do. Well, that's how my home music with Mare started, is trying all the music with her and realizing its value and doing the research and then expanding it into working with other children. So that's been my life passion. And now,
it's an incredible job you're doing. I mean, music and children's development, child development goes hand in hand. And music has so many aspects to it. So obviously, you have your channel and website as well, isn't it? So congratulations on that. And in terms of the MER stands for Medical Education and Research. So JIPMER is Jawaharlal Institute, and PGA is Postgraduate Institute, and then Medical Education and Research is the MER. So as you said, I've had a long journey. It has been exciting, and I love to serve babies and their parents. And as you said, I've had the opportunity to work in many units, support the teams, and develop the NICUs as we go on. So it's a challenge and it's exciting at the same time. And really, I'm loving this current job in terms of serving the whole community, Telegram groups and Facebook groups to guide young doctors. So that's giving me a great opportunity to serve the wider community, not just my hospital or the patients linked to it. So I really enjoy it. And thank you again for mentioning those.
Oh, you're welcome. So what our topic is today is discipline. And I'm sure that you've seen every single type of parenting discipline techniques. You know, you have the authoritative and the authoritarian and the permissive, as we know in psychology, we learn. And many people say, you know, you can never spoil a baby. What are your thoughts on that?
Very interesting topic, and thank you for starting with this point, because babies learn from us, and discipline, I don't know how many of you know the meaning of the word. Disciplinaire is basically to educate, and discipline is basically education, and education in the right things that you're supposed to do. So it's basically reinforcing the positives you need, the traits you want to express, and suppressing or inhibiting the negatives. So there is nothing like you can't spoil the baby, because the baby starts learning from the word go. I'm sure we will go in depth as we go on, but I disagree with the statement, and we have to be careful what examples we set right from the word go. If you want me to elaborate now, I mean, basically the babies, the first 2 months you can say is, the first 2 months goes off in baby getting used to the external life. So they've been so used to the cuddly, dark in utero environment where the music is a mother's heartbeat and everything is dampened in a way because they're floating in fluid. They're nicely swimming along and they're supported. The work of oxygenation, everything is done by the mother. So from this environment, the baby comes out, and the first 3 days obviously is a big change in terms of the cardiorespiratory adaptation, and that's where the neonatal intensive care comes into play. If the baby is full term, not preterm, if they have difficulty transitioning, we help them. But the first 2 months as a whole is like the baby learns to feed, to establish himself or herself in the world. They don't really care who is around them as long as they are fed, and they're not thinking about what's happening in their surroundings. But at the end of these 2 months, when we start seeing a social smile, the social smile is the first reflection that the baby recognizes you as a person, and they start reciprocating, the feelings start reciprocating. And this is the time that we really have to think about every step we do. There is a lot of interaction. There is cues from the baby, cues from the mother, and the way we respond to these cues. And all these matter in the first 2 months, but that gives them the trust. And you mentioned psychology theory. So the trust that the baby has in the future depends on how we respond to the cues. But it doesn't mean you have to respond to every cue with a feed or with a pamper, because you need to find the right balance. You need to find out what your baby means, because many times we think a baby means something while they actually mean something else. You're a grandmother now, so you must be seeing that not every cry is for hunger. They have nappy changes needed. They have temperature adjustments in the room. They just want to be fussy because they are sleepy. So sometimes feeding more actually can be counterproductive in this situation as well. So in the first 2 months, what I stress, get the feeding pattern right, get the way you respond to the baby's cues right. Don't assume that you know everything. Don't assume that everything is due. It's always a trial and error. So you try something. If it doesn't work, you go back, but make sure that you're not so-called spoil the baby in the process. You have to understand that you have to really have a pace. It's easier in the first 2 months to decide on this, but as the first 2-3 weeks go by, the colic phase starts, it becomes more challenging. So just to summarize the first part of your question, you can spoil the baby and you should start discipline from 2 months onwards. The first 2 months as well, the way you respond to the cues sets the pattern for what happens after 2 months. So I would say start from the word go.
Thank you. I've always thought that, and people always are like, "What? No, you can't spoil a baby." But when I think about the example I always use when I do my workshops on using music to help instill discipline and control with children, is when the 9-month-old drops something and we pick it up and we hand it
Yes.
back to them. And originally, it's just that their muscles relaxed and they didn't do it on purpose. But then when we keep picking it up, they're learning it's a game. So at one
Yes.
point, you have to say, if you drop this again, I'm going to leave it on the floor, And I always make a joke with parents saying, because if you keep picking it up, you might as well give them the car keys now, because you're never going to win a battle when they're a teenager, you know? And so I think that most of the discipline we're doing during these first few months is unintentional. And parents worry that if they don't respond immediately to the child's needs, then they're hurting them. But you're saying that it's become in tune with what that cry might actually mean, and it's okay to not respond right away to all of them.
Yes. Think more about what is happening and try to figure out. I'm not saying this is discipline in the real sense of the word, but this is where the baby starts learning. And after 2 months, it gets very interesting because the baby starts reciprocating, the smiling, the babbling, the laughing, the waving, everything starts, and it gets more fun for the parents as well, because the first 2 months is really work, work, and no returns. So they put in so much effort, but really the baby is not responding to them. It's just you looking after the baby, losing your sleep, but you don't see anything back apart from, of course, seeing the baby gain weight and so on.
Right.
But after the 2 months, the more gratifying situations happen. The baby, after the head control starts by 3 to 4 months, you start putting them in the high chair, they're looking around, they're observing. So this is the time when they start looking at how you treat the siblings or how the siblings respond to you, and your own self-discipline starts manifesting. So we always say that the parents or the person responsible should be a good role model. So we should keep that in mind, that this starts from the time, if the baby observes you shouting at your older child or your spouse, for example, they are observing it. They don't know what shouting is. They don't know what you're shouting at, but they get excited by this noise around them. They see your facial expressions. You might see the baby smile in response to your facial expression. They may make funny expressions. So obviously, the babies learn by observing, they learn by imitating, and they learn by how you respond. So the attention part of it. So these 3 points are very important from the 3 to 4 month stage onwards. So you have to think about how the baby is observing, how the sibling is interacting with the baby, how you are treating the sibling. If your older child is having video games and they watch it, the child is observing that. And obviously, I'll come to screen time later on as well. But remember that you cannot have one rule for one child and one rule for the other child. So you have to have a reasonable balance in how you approach it. If a parent asks me the older child wants to play a video game, I tell them don't play it in front of the younger sibling who is just watching, and you need to avoid screen time. So you have to divide the time away from the time the baby can observe. So you cannot really, babies cannot differentiate. They are not mature in their thinking process. The other important point is self-regulation. So we discussed about the hunger cues or the cues that the baby shows and how you respond to it. So in a way, not responding instantly or thinking about what's happening or giving a pacifier and waiting is allowing the baby to self-regulate. Ultimately, discipline is self-regulation. So you know that something is not desired and you want to regulate yourself not to do it. That's what happens in later life. So the word self-regulation is very important in terms of the baby learning to hold on, and the role model of both the siblings and the parents becomes important as well at this stage. Screen time is a big negative in terms of discipline, and many parents start introducing the phone the moment the baby starts getting excited. So please don't do that. There is big regulations from the AAP and other bodies not introduce screen time till 2 years. There is a misconception that babies gain from watching nursery rhymes or alphabets. Remember that learning is a process. The babies learn when they are mature enough to do that, and that's why we have school. That's why we have the age range. So there's nothing that's going to be gained by starting this early, and producing it in the form of screen time produces it in a way that is not natural. It's much faster, it's edited, it's much louder and much more funny than real life is. So they start losing their self-regulation, so to speak. So screen time is a big negative for discipline as well. So the right term that you used, when the child at 9 months starts playing, when they start engaging, they start understanding a little bit of language. That's when the real discipline starts. So do you have any comments on this aspect, the 4 to 9 month stage? So first 8 to 9 months is purely allowing the child to self-regulate, understanding the cues, not overdoing it, not pampering the baby. So it's like you are a role model. You teach the baby to self-regulate, nothing more than that.
That's extremely interesting because you know the school of thought has always been that the baby doesn't really get all of that stuff that's going on or take in the significance of it. And the fact that you're saying they do, and if they're seeing other kids, siblings, or if maybe there's not other siblings, but they always see mom and dad on the screens and on the computer, then that becomes part of what is hardwired. Like when they get older, they think that is what the norm is. They're supposed to be doing that themselves.
Yeah.
Wow.
So basically, the
Wow.
brain grows rapidly in the first 18 months to 2 years, and the actual size multiplies from 500 grams to 1,500 grams. So it's a huge
Wow.
growth, and after that, after 2 years to adulthood, it's just going to grow 300 to 500 grams again. So you can see the proportion. Even the head size reaches like 3/4 of the adult size by that age of 2 years. So you can imagine how much growth is happening, and you can, the human brain is very clever, and the babies learn a lot at a, that's the most rapid pace that anything happens in our life. So the first 1 year to 18 months is a period at which we learn the fastest. There is so much of brain development in terms of connections between the neurons. After the 12-month stage, the pruning starts happening as well. So what you have connected in, you connect in bulk, you do excess of connections. The pruning is a process where it is defined this is the part of the brain I'm using more regularly, let's keep it, and this is the part I'm not going to use, so I will discard it. And that's where the impact of screen time comes in the first 18 months, because you don't want to expose such stimuli to the brain when it's actually in the pruning stage, so you want to define it better. So this is the physical development of the brain, and obviously learning doesn't happen instantly. The baby keeps accumulating the experience from the time of birth in a different form, as you said, internalizing. You can say there is a expression is different, but internalizing happens in the brain, and all this is what leads to the ultimate brain form we have, and our behaviors, everything is regulated. Do you know that the first week how the baby feeds makes a big difference to their future risk of obesity? So it's a huge impact that the quantity, I mean, the breastfeeding baby feeds very small amounts. The milk keeps increasing in the first few days. But when we start formula, we have a number in mind. We say baby has to take 30 ml on the first day, 50 ml by end of first week, and so on. While a breastfeeding baby will probably get 5 to 10 ml on the first day. And this sets their pattern for the whole of life. So there is something called programming. So we have genetic information in our body. We have programming where what happens in a crucial period, the first period before delivery as well as the first period after delivery. So you can say the last 2-3 weeks of pregnancy and the first 2 weeks of life is when most of these stimuli have an impact on the brain. So in terms of your brain development and intelligence as well, these play a significant role. So there is no doubt that the first period is important, but the way we respond to it is different from what happens. So you're not going to teach the child, but you are going to observe what's happening. You need to be careful how you react to each situation, because each thing has an effect on the baby.
Wow. That's very interesting. So it does mean a lot, and there's a lot more than even I thought. When I was thinking about having this topic with you, I wasn't sure whether my gut instinct of, wow, we're starting discipline right now, was in fact true, because so many people go with the other school of thought that don't worry about it in the first few months. But I kept thinking that can't be right, because everything is part of their growth in these first few months. So are patterns. So I'm thinking also now they're starting to, in their brain, get the ability to get ready to form words as they're playing with sounds, right? So there's might be some key words and phrases to use when you're correcting an infant, for as much as you would be correcting an infant. But infant toddler's behavior, you want to be sure the language you're using is helpful and words you want them to use. So are there some key words and phrases you suggest to parents when they are working on correcting behaviors?
Certainly. I mean, the correcting behavior starts only after 9 months. So, in the first 9 months, you're only setting, and this is where the misunderstanding comes in the general population about discipline, because we think of discipline as an active process. There is a lot of passive process going on in the first 8 to 9 months, as we discussed, which we kind of ignore, but this is laying the foundation for what happens after the first 8 to 9 months. So we need to wait till 9 months to actively start disciplining, because the child needs to understand language to some extent. They do recognize some words before that, but they're not going to really, they may understand the tone of the voice, but the linking of words to certain meanings or to people starts coming in by that 8 to 9 month stage. You mentioned about language development, and there is a very interesting aspect in the first 4 or 5 months when the child starts making sounds, and even after 9-10 months when the child starts vocalizing more complex sounds, you might see that the child is doing very well, and then goes through a phase when they become very quiet. They're not producing any sounds. This is the time they are absorbing, they're practicing to get more complex sounds. So they are practicing within themselves, they are internalizing, they are trying to figure out how does this sound come. So that's a very active learning process, and many parents are worried, is my child abnormal because he was speaking or making different sounds, but now he has gone quiet, but he's still responding. So the positive thing there is that it's actually going to come out with a more complex form of language, and each time they are going to jump a level, they go quiet for some time, they internalize, they think about it, and they come out. So this process that we do it ourselves, when we are learning something, we internalize, we think about it, happens in babies as well. And That's how they start doing more complex tasks. And you pointed out dropping objects, picking them, the way we grip objects. So all these, they have to think. Fine motor development is closely linked to intelligence. Language is closely linked to intelligence. Moving, walking, etc. is gross motor development. So we have different fields, and the gross motor is not as directly linked to intelligence, though you need a normal functioning brain and muscle system. But the language and fine motor initially, and then the social aspects of it, very important. Uh, the point about what was it we were discussing when I digressed to the development?
Well, I want to,
The language, yeah. You mentioned
yeah, I
about the
want to go
word.
back to, right, what you mentioned 9 months as a
Yeah,
time when you start to redirect behavior or correct behavior.
correct behavior.
Why 9 months?
I mean, 6 to 9 months is a stage when the child starts moving. And when they start moving, we have to make sure. I mean, I'll talk about the words aspect now, because one of the
Okay,
words that you have to keep away from is no or don't. So
right,
that's a key aspect we should remember. And between 6 and 9 months, when the child's understanding is limited, even if you say anything positive, or I mean, the way we are supposed to put any guidance to the child is in a positive way. So if you want the child to sit and play, you don't say don't stand and play. We would say, can you please sit down and play? So if you want
right,
the child to switch on the TV or switch off the TV, so you don't say switch off the TV and go. We can say that let's do this new activity, and we will switch off the TV in the process. So you are trying to make positive meaning, even though you're conveying the same thing, the way you say it is different. And there is a big school of thought that you should avoid no and don't as much as possible. And in between 6 and 9 months, the baby starts responding to the tone of the voice. The baby can recognize no, for example, but he doesn't understand exactly what we mean by no, but he may understand that it is something that you don't want to do. But the more often we do it, one other aspect we should understand here is attention seeking behavior of babies. So for them, between 6 and 9 months, they are looking to do anything that will bring positive reinforcement or attention. But the word positive in this sense is for them how they perceive it, not what the parent perceives it. So that's why we have to be clear when we react to the child in a laughing or happy way. What we do now is what the child will understand for the next time. So you cannot say I laugh 5 times, but if you do the sixth time, it's not acceptable. Consistency is other key word here. So we have to be consistent. We have to allow the child to explore safely without using the no or don't word frequently. So we have to create an environment that the child can safely play without much of obstacles, and try using the positive way of saying things. Between 6 and 9 months, it's not going to make a huge difference because the child's understanding is limited. So the child is starting to roll, to crawl, but they're not really independent. So they're trying to learn. So you just make the environment safe. A playpen is a good place, and you avoid any obstacles, you avoid any dangerous things. And between 9 and 12 months, the child starts understanding more. So you start practicing the language, the positive way of saying things that I discussed. Be consistent. I mean, and here consistency is not just in yourself, it's in the whole family. So you have to discuss with the family how your approach to discipline is going to be. You have to discuss with the family what is acceptable, what is the limit you take, and what is not acceptable, and draw a line there. And for yourself, the consistency comes irrespective of whether you are tired, whether you are fresh, whether you want to be playing with the child, whether you want to do your office work and let the child engage himself. So your approach should not be different. The way you react is what sets the scene, and the baby understands it. If you react differently, or the dad reacts differently to the mother in certain situations, the baby gets confused, and confused child is going to be hyperactive, or other issues come up as well. So set the
mm-hmm,
scene. Always be imperfections. We are not going to be 100% consistent, but as a whole, try to be as consistent as you can be. So the language wise, I told you positive language. Avoid the use of the no and don't unless it's seriously threatening the child. So try to remove the situations where you would want to use a no word or don't word. And when it does happen, it should be something really serious. And you can distract the child instead of saying no or don't. In the young babies, they are easily distracted. distraction is a very useful tool in discipline in young kids, because you just have to move them away or bring them another stimulus. So rather than snatching a remote control before they throw it, you just have to bring another toy which takes their attention and smoothly remove it. I mean, you are much cleverer than the baby at that stage, thankfully.
Hopefully.
Hopefully. So you can fool them, you can distract them, and use these techniques, and never lose your own cool, because if
That's an important one.
we have very difficult situations. You said your daughter is hardly sleeping, and we are used to sleeping for a certain number of hours a day, and when we don't sleep, our brain really doesn't work well. We lose our cool, we are short tempered. We can easily show it on the spouse or mother, but on your baby you're not going to show it that way. But the way you react may not be as nice as you would want to be. You may be impatient even with the baby. And definitely, I mean, as a child starts getting older, they learn more and the tantrums start coming in as well. So this is the time when we really need to show we are in control. We shouldn't lose our cool. We should stay calm. The way we react to tantrums, we will discuss next as well. Do you have anything to add in terms of language? Of course, music helps as well.
Doesn't it, right? Yes, I agree. I've written songs like that. I've always learned that the brain only processes verbs and doesn't process negative commands. So if you say don't run, the brain is hearing run.
Yes.
So I think that fits in very well with what you just said. You mentioned temper tantrums, and I know this isn't in our list of questions, but it does beg a question from me, because if you follow these techniques in this first 12 months, does it have an impact on tantrums? Like, will tantrums be less often if the child has a more consistent vocabulary and demeanor from the parent?
I mean, there is no guarantee, but it's likely that you would be more in control. It's likely that you would be able to handle, because the tantrums do happen because the child is getting more independent. It's a show of authority or a tussle between the parent and the child. One of the points I would like to mention here, you mentioned the way the brain processes information, and don't is ignored and they want to do it. But the same way, uh, we have to reinforce positive attention. So when the child does something good, start praising from very early, and start bringing in manners from the very early stages. So when you speak to the child, start saying yourself thank you, or ta, or whatever you want to say. And when the child does something, even from 8 9 months, when they start stacking toys or building blocks or putting a form board piece, praise them effusively. But if they do something that you don't want them to do, ignore it. So I mentioned distraction is one technique, praise is the other technique, because praise brings out, because a child wants attention, and they start doing negative things to gain attention if you're not giving them attention positive. So if they do something good, you praise them, so that takes away their feeling that they're not being attended to, and so the negative tasks won't happen. And the reinforcement from the parents, whether it is positive or negative, does bring the same action to repeat. So if you attend to a negative task, by negative I mean something you don't want the child to repeat. So if you attend to it, then the child gets the attention they want. So you really want to
Right.
ignore something which is negative. If you don't ignore, you get frustrated, you lose your temper, and I told you about being in control as well. So you have overlap of all these. When you positively praise the child starts doing more positive, so less room. I told you to remove the distractions in the room, the danger things, not allowing the child to get hold of the medicine pill box before you have to say don't take it, I mean, in the first place. So think about child proofing from the early stage. Be a role model, don't lose self control. At the same time, if the child does something, they do experiment, they are supposed to. Anyone is bound to throw a tantrum, anyone is bound to do something that you classify as naughty. So you have to ignore it and move on from that. And in terms of tantrums, hopefully this approach will help the child self regulate better, because tantrums is a failure of self regulation. And when the child has so much going on around them, they want to do things faster they can physically do or mentally capable of doing. They want to imitate their sibling, they get frustrated, they want something that they're not really able to handle, and the parent says no. They're not ready to take no for an answer, because you have not taught them in the beginning to self-regulate. So self-regulation becomes a key when it comes to tantrum. But irrespective of everything, tantrums do happen, even if you are having the best parenting skills. And I mentioned the inconsistency. So as a child grows, when you reach the toddlerhood, you have to anticipate when the child is likely to throw a tantrum, when they are tired, when they have missed a meal. So when you have some activity planned, plan it in such a way that you avoid such times, or you have a nap earlier, you have the meal preponed before a party, for example. So don't allow the child the grumpy feeling when they are more likely to tantrum. And even if a tantrum happens, you're supposed to relatively ignore it in a safe way. And as a child gets older, you start even timeouts can start from 9-10 months onwards in a simple way. And the reason for timeout is not to punish the child, it's purely to allow the child to self-regulate, internalize what they go through, give them the ability to control their feelings and emotions, and also to point out that what they are doing is not really what the ideal is. I know this is out of the discussion topics, I just mentioned it.
Yeah, I think that's wonderful. It's basically, we need to treat everyone that way. Step back when you notice that it's something that they're really upset about, and give them space to work through their emotions. We should do that with people of all ages. Excuse me. You mentioned something about okay, I'm sorry, let me back up a second here. If we do not follow through with this, we have negative results, just as we do with adults. When you see an adult is really upset about something, saying calm down is not going to help. It's probably going to make it worse. So when you see a child is upset about something, to understand you to say that you need to back up, let them work through it, and just make sure they're
Exactly.
staying safe.
So you can start empathizing with them. Words like "I understand how you're feeling," or you can say, "I know you're frustrated for this, but this is how we deal, and you are throwing something that's not acceptable. So you may have to go to the naughty corner." The child tell the child that you can come out of the naughty corner when you're ready, and then you're not going to show that this created any dislike in you, and you are going to stay that normal self, but have a firm voice and tell them that what they did now, explain what you're doing, but keep your sentences short, because a child is not going to really comprehend. So don't tell a story as to why it's wrong. Say that you threw it, so it's wrong, and then put them,
Okay.
so that this will don't make a big story. Like they say, one word per year, so you can say 2 words
Keep
for
it
1 year,
simple.
3 words for 2 years, and so on. Yeah.
Keep it simple.
Keep
Yes.
it simple and very short, and just a message. Don't tell stories, because after 4 or 5 years they understand stories, but they will start telling stories to you as well. But in the first 2 3 years, they're not really interested in the story, they need the message.
So, what are the consequences to not giving a child discipline and correcting behaviors?
I would put discipline and screen time in the same window, because they go hand in hand. The parents who are more interested in a sensible approach to discipline probably will avoid screen time as well. And both have a significant impact on the developing brain, how the child copes as they grow up, how they respond to people. And the empathy part I mentioned briefly earlier, try to bring it in so that by the time they go to nursery, they already know what is right, what is wrong. So when you're telling stories, the picture books are a good way to spend time instead of screen time. So start reading to your baby right from the word go, and by 8 9 months, when they start interacting, start telling them stories. Language development has a lot to do with this as well, repeating the same words, pointing to objects. So it brings in so many positives at the same time. So in terms of the negative effects of not approaching it that way, obviously the same thing that I mentioned about spacing the feeds or allowing the baby's cues to respond properly, so you get more sleep. So similarly, as a child gets older, you get more peace of mind, less tantrums, more control of what's happening, a happier family, I would say. I don't think there will be any tangible long-term disadvantages. Even the children who are throwing huge tantrums at 2 years that I see in the clinic, they become okay by the time they're 4 or 5 years, and they respond well to the school. And these are the kids who start recognizing the outside feels better. So if the discipline at home has failed by the time they start school, they start responding better. So these are the aspects that we should be looking at. You need some water, Marianne?
Yeah, I just took a sip. Sorry, excuse me.
No.
So I've heard in some of the workshops I've attended that when children are not disciplined, they become angry and as teenagers and depressed because they have no basis for how to behave. And I'm wondering, is that starting now? Like, is this when a child is displaying anger, or they get frustrated because they have no boundaries?
It's true to an extent. I mean, but obviously, whenever a stressful stimulus happens in life, for example, if the parents get divorced when the child is 6 years old, even though they were perfectly disciplined before that, this period of turmoil is going to affect their response. So there is no guarantee that you set the foundation and hope for a good growth. I mean, for example, if you are doing very well in primary school, it doesn't guarantee you do well in secondary school. You still need to keep working. So it never stops. So the positive environment you create for the child, the good family background, the interaction of the family unit. So all these matter. And later, as the child gets older, the peer group, the way you have a good peer group around you, keeps egging you on to the next stage. So we never stop learning in life. I mean, you and I are still learning every day.
Yes.
So we have to cultivate that. And I cannot relax one day. I mean, one mistake at work and all whatever I have done till now is collapsing. So that's the way it happens with children as well. So the good foundation always makes it more likely that you would have a successful future, but you cannot stop working. So we need to keep working on it. And whenever there is a negative impact, obviously it can affect whatever was learned before. You can go in a different direction. But what I said earlier, that you can always correct it. It's never too late. You try to do it properly from the beginning, but in case you didn't know and you're just watching this program and your child is 2 years old, don't worry, you can still fix it.
All right. Well, that's good to know there's hope. I see we have someone here saying a very nice program. The last name is Malvia. And we also have Sana that works with our tool, saying very true and saying hi to us. So I'm glad some people are watching and finding the information helpful. We're getting near the end. So if any of you have a question, you have Dr. Sridhar's attention now. All right, here's a question for you. Hi, Carabeth. Nice to have you on the show. Carabeth is a kindergarten teacher that attends my program with her child. And her question is, what can we do as teachers when we have many different needs in a classroom? You know, you have a bunch of 5-year-olds coming into school, all in different directions. So I guess a lot of this depends on whether parents set that good foundation, how difficult the kindergarten teacher's job is going to be. So I guess that's an important part here too, is that what we do in infant toddler development has a direct reflection impact on when a child enters school. So I'll be
Because when we
quiet.
start talking of self-regulation, I mean, we're also talking of how sensitive the child is, how they're able to cope with negative stimuli. Because when they start going to the outer world, they start facing negative stimuli as well. So they have to understand that people may say something you don't really like. They may say no to something, and you still have to accept it without being overly sensitive. So when we talk of self-regulation from the beginning, this helps you cope with it. So this is one part. As teachers, you need to recognize that different families come from different backgrounds and not every child is going to be the same. You have to find the strengths and weaknesses and maybe feedback to the parents to work on certain aspects at home. For example, if you find that a certain child is tantruming more or sleepy in the class, tell them to adjust the sleep times, cut the screen time at home, spend more time reading with the child. So you can find aspects where the child needs to improve and give a specific feedback to the family, because ultimately the teacher has a limited time with the child. It's the parents who still do have a lot of work at home. So you have to guide the parents in terms of what they can do so that child becomes easier for you to handle in the class. So you have to be clever as well in this respect.
So make a partnership. Partnerships are really
Exactly.
important, especially in that kindergarten year where it's
Delegate
very
the
important.
parents to.
It's that in between from leaving the toddler stage to the pre-K stage and then onward, because then there becomes less interaction, unfortunately, with school and parent, because parents seem to get more into whether it's school now can focus more at work, and teachers are like, no, I still need your help. So getting everyone on the same page in the beginning can be very helpful. And I want to thank Kara for coming on and asking that question.
Thank
I
you.
hope that was a good answer for you. And if not, if you have a follow-up question, please put it up there. She's saying, thank you. Specific feedback is a great idea. We want to respect the different family structures, but also do what is best for the children.
Thank you.
So tell us a little bit about how people can find you to reach out for help or guidance. And I know that a lot of it is on the Facebook and the YouTube. But if they like watch a YouTube video and they're like, oh man, that was really good, but I want to know this, then how do they say, watch your YouTube channel, but I have a question?
Actually, I mean, if you go through the videos on my channel, there are many questions from families asking even medical questions, and I do respond to all of them. I know it doesn't offer you the privacy, but I can't respond to individual messages on email unless you need to send a photograph or something. I mean, there are videos on Squint, for example, and they send a specific picture, and I can comment on that. So I just want to improve the engagement on the channel as well. So do comment on any video you find, and with your permission, I'll share this recording as well on my channel. So it has been a very useful session, and YouTube channel has many videos. It's organized as playlists for different topics, and it covers medical and non-medical. So please look at the playlists for parents in this case. The Facebook parenting group is there, and Maryann's group, the early child development, is a great tool as well. And I do share some of my development related videos on that. Thank you for permitting that. And in terms of general advice, of course, if you want to have any specific discussion, email option is there on the YouTube as well. You can email me, but comment on the channel to say you're emailing. Many times it goes to the junk, so I need to look for it.
What is Telegram groups?
The Telegram group is more a medical group, so it's a medical discussion. I mean, where colleagues from all over the world. It now has nearly 8,000 plus members, and they're all either doctors or nurses. It's a private group for medical discussion. So they have questions about a particular case, how to handle that. So they ask those questions, and me and my colleagues, who are other senior colleagues on the group, try to help them out. So
That's
it's like developing part of the world, they don't have as much facility for continuing medical education, and my channel has sections for that. But to learn more or to ask in-depth questions about a particular patient, for example, a particular rash on the skin or a swelling on the baby, what it could be, or when they're having a very sick baby, what kind of medicine to use for that situation. It's not going to be the absolute guide, but it is a kind of hint in the direction they should take, because we are experienced, we have the best resources, so we are in a better position to guide them.
Okay. Well, I really enjoyed this talk. I learned a lot myself, and I appreciate that. And I want to thank you for your time. And everyone, now you know how to find Dr. Kalyana Sundaram. You know how to find him. And he is very approachable and very kind and generous with his time and knowledge. So thank you for being here today. Please hold on a second before going away, as I just want to have some closing private comments with you. So is there anything you want to say before I go to our goodbye?
Again, thank you and the whole group for doing this great work. Keep going. Thank you.
Thank you.